Hi, it's Mark Kris from Memorial Sloan Kettering. Talking today about a number of issues of our time, and at least in my mind, how they're intertwined. The first one was a great article by Danielle Ofri that appeared in the New York Times in late January of this year. And what this article talked about was this increasing tendency of our patients to show that they're not anxious to have the new COVID vaccine. The common scenario in her practice and in mine is, Doc, I'll take the flu shot, but I'm not going to take any more COVID shots. And what it has done for her and probably for me too, it has led to some hesitancy in pushing the agenda. And, you know, we really should push the agenda. These vaccinations for COVID-19 have totally changed the face of the illness. At least in my practice, it turned it from a deadly illness to a not deadly illness. And who can say that that's important? And again, she reminds us we need to take up that fight and not get fatigued and do what we can to overcome, I'll call it, a COVID vaccine counseling fatigue. It reminds me of another fatigue that we had, and that is to deal with smoking, ongoing smoking in our patients that are current smokers. And it's particularly important in the lung cancer area. The truth is, it's been shown over and over again that patients with lung cancers that are smoking at the time of diagnosis have a more difficult time with surgery, more difficult time with cancer treatment, and don't live as long. But what's happened is because it's so hard to get folks to stop smoking that are smoking at age 70, had lifelong smoking, that many of us have developed a counseling fatigue for smoking as well. There was a very good paper a few years ago in the Annals of Internal Medicine from Dr. Sheikh. And what they did was they looked at the outcomes in patients with, there were current smokers that had lung cancer. And what they found was if you were a current smoker with lung cancer and you stopped smoking, your chance of overall survival was improved by 12% at 5 years. And your chance of disease-free survival, progression-free survival was improved by 10% at 5 years. Now, just to put those kind of numbers in context, again, these are never smoker numbers. These are smoker numbers. In the entire patient population with that were offered treatment with pembrolizumab, a year of adjuvant therapy with pembrolizumab. Again, this is for the entire study population, not just the current smokers, which did benefit, by the way, from the pembrolizumab. They noted an 8% improvement in 3-year survival, disease-free survival, and a 2% improvement at the time of the analysis of 5 years. So by all means, these are important numbers, but we have this opportunity in the current smokers to do that. Now, another opportunity that has come along, and I think it's gotten somewhat confused, is the use of nicotine replacement, the use of e-cigarettes. Of course, e-cigarettes need to be fought, particularly for people that have never smoked cigarettes. Clearly, they are something we can't let our young folks get into, and we need to fight it every step along the way and do all we can, both in our practices and in our personal life. However, for patients that are current smokers, where other smoking cessation strategies have failed, the use of e-cigarettes has made a difference. And there were 2 papers in the New England Journal, one by Haychek in 2019, that was a randomized trial of e-cigarettes versus nicotine replacement, and a more recent one by Auer in 2024 that again showed that electronic cigarettes were better than counseling. So please don't give up on getting your current smokers to stop smoking when they have a serious illness, be it lung cancer, be it heart disease, be it COPD, be it stroke. The second thing is please think about using nicotine replacement therapy for these people. I know we don't want to do it, for people that are not current smokers and for young people. But for the people that are smokers, it's been shown in randomized trials to be better than nicotine replacement and be better than simple counseling. Please remember the old data that you're looking a patient in the eye, telling them to stop smoking does have influence. And I urge you not to develop smoking cessation fatigue, counseling fatigue in our patients that were current smokers. And by the way, we should also avoid the fatigue in counseling for COVID immunization that also many of us are developing. We have a chance to improve the health of our patients with a very non-invasive and minimally adverse effect-ridden intervention. And we can't be fatigued. We need to be vigilant in getting our patients to take the best vaccines available for them and to follow the guidance of our national authorities and guideline panels on this.